You're watching Arab Health TV, and now we're going to be in conversation with Sidra Medicine, and we're very kindly joined by their Chief Medical Officer, Professor Ibrahim Janahi. Thank you very much for joining us.
Thank you.
Let's get started off with the world of precision medicine. What is it all about, and what's the big message of Sidra Medicine here?
Great. Thank you so much for the questions. Thank you for the visit to our booth to start with. And then to answer your question, precision medicine is a fancy name for personalized medicine. So what does that mean? So in general, when you get sick, you have an illness, it's caused by something, and typically there is some sort of a vulnerability to that disease. It could be a genetic sort of milieu that is making you more vulnerable to this sort of disease. And then you get an environmental factor that comes in, whether it's an infection with a virus or bacteria or something like that, or an exposure to a toxin, exposure to something in the environment that leads to those genes to be triggered to cause disease symptoms and signs. And then the conglomeration of these symptoms and signs and what it does to you is the disease itself. Now, in general, up until very recently, physicians, doctors would go and treat you with a sort of a generic medicine, an antibiotic, or let's say blood pressure medicine, or blood sugar lowering medicine, and so on. But that is a generic thing for everybody. In general, when you are doing that, it might work with most of people, but there are a good number of people who would not work with them because of different reasons. And personalized medicine or precision medicine tries to figure out what's going on. So it focuses on the genes, and what happens after the genes is basically you translate that into proteins and into pathways and to different what we call omics, so metabolite, different things that are triggered by that gene. And it differs from a person to a person. So personalized medicine is trying to identify the cause, the root cause of that, and trying to really make treatments and target those specific pathways that are specific for that you particularly. So you might get exposed to something and you react differently than somebody else. And that personalized medicine is trying to find out what would you react to versus what would the other person would react to the same stimulant or the same disease or same exposure.
And what are you showcasing at this year's Arab Health? What's the big message?
So Sidra Medicine is trying really to practice personalized medicine, precision medicine. And with that, we have been introducing some new therapeutics in terms of gene therapies for some of the very most difficult diseases, some of the diseases that used not to be treatable, like SMA, which is spinal muscular atrophy. It's a disease, devastating disease that hits children, and it leads basically to them being paralyzed since right after birth. Now there is a treatment that basically targets the gene itself, and at Sidra Medicine we have been offering that therapy already. Another disease that we already started offering some genetic targeted therapy for, which is called DMD, Duchenne muscular dystrophy, is another very devastating disease that leads to paralysis as the child grows up. He becomes weaker and weaker and weaker until that person, that child actually starts losing its ability to walk or do what the whereabout movement. And this gene therapy targets the culprit gene and fixes it. So Sidra Medicine is showcasing these types of therapies. In addition, we also are, as you know, Sidra Medicine is specialized hospital for children and women's. And then, so our women care are more, again, targeted towards women health more than disease. And we're trying to tackle all the different aspects of women health, including post-menopause issues, including mental health. Women's mental health is very particular, it's very special, and they have their special needs for the mental health needs. And Sidra is trying to put together a package of mental health for women and care of women's health in general.
Amazing. Well, thank you very much for joining us, Professor Ibrahim, and we wish you all the very best.
Thank you so much.